So today we are going to talk about post-op day 2 to 5 appendectomy. Chhavi Sharma will help
Hello
us
everyone.
demonstrate.
So our today's topic is fluid and electrolyte disturbances, and we have to do the post-operative day 2 to 5. And I am Dr. Chhavi Sharma, and here is my patient Suman Sharma. So our case is appendectomy, and now we have to take the vital signs of the patient. For the vital signs, we have to ask the subjective information from the patient. So, do you feel diarrhea?
No,
Do you feel vomiting?
no,
Are you the patient of diabetes mellitus?
no,
Do you feel the abdominal pain? On the points from 1 to 10, how much points will you give to the abdominal pain?
4 point.
Okay, so now we take the vital signs, and from the first, we will take the pulse and respiratory rate. For the pulse, okay, so we have take the pulse and the respiratory rate. Now we will take the temperature of the patient. Now we will check the temperature of the patient. Keep it in your mouth, under the tongue. After some time, check the temperature. Okay, the temperature is normal, 37. So now we will check the blood pressure of the patient. After some time, check the blood pressure. It's okay, it is normal, 120 by 80. Now we will check the consciousness of the patient. Since it is the second day after the operation, our patient is responding actively, so it means she's in a good state of mind.
So we see the post-operative day 2 for appendectomy. The patient came in with appendicitis. This was recorded on 1st of November 2020. We see the attending here, or the doctor is Chhavi Sharma, and the patient is Suman, age 30. The patient is then transported to a post-anesthetic care unit at 4 o'clock and later to a general ward at 5:45. ICU was not required as we did not see any complications. Patient did not experience any vomiting, diarrhea or bleeding, which is a good sign. That means the surgery went well, and they do not have any complications. Abdominal pain complaint was 4 points. And then we took the vital signs. Pulse is normal, respiration, breathing is normal, which is 18. Mechanical ventilation was not required. Blood pressure shows normal, 120 by 80, and consciousness, the GCS point is 14 at the time the patient came out of the operation, as she was unconscious. And then we see the rise, 15 point. The temperature is normal, 37 degrees. Skin and mucus is moist. So next we see the IV line and access the cannula. Yes, that is inserted to administer fluids. At the site of surgery, we do not see any hemorrhage or dressing state. Patient does not experience any vomiting and drain losses. We do not insert NG tube as the patient can eat and the wound is drained. Next is urine observation. The color of the urine is light yellow at night. At the same time, we observe it is 2 times more, 400 milliliters, and as you can see prior, it's 200 milliliters. There is no catheter inserted. We do not see any blood or presence of stones in the urine, and the concentration is not changed. Next is the diet. By mouth, there are no restrictions. Still, we have changed it from NPO to clear liquid. An alternative can be done by NG or OG, but that's not required. There are no complications. As mentioned prior, the re-examination is done in 15 minutes or 30 minutes, 1 hour, 2 hours, 4 hours, 8 hours, and in the morning 6 a.m. Dressing is changed regularly in one day. There is no mobility or activity of daily needs. Next is computing intake and output milliliters. By mouth, it's changed from 0 to 2000, and by IV, it's done to 1000. The intake and the output is 1500. There's no vomit, and the drain is less than 240. We see a local status, that is the abdominal pain is 4 points. There is no distension. There is flatulation because of no movement, lack of mobility. There is peristalsis but no stool. So technically, conclusion is that the patient is recovering. We see better out. So today is the post-operative case day 3 of appendectomy. This is recorded on 2nd of November 2020. We see that the patient is now having abdominal pain of 2 points only, as earlier it was 4 points. No experience of vomiting, diarrhea or bleeding. Vital signs are normal, like pulse, respiration, blood pressure. Consciousness is 15 overall. Temperature is 37, which is normal, and the skin is moist. IV line is yes given, but later it's not given as the patient is discharged. We do not see any hemorrhage at the dressing site, and there's no vomiting or drain losses. No NG tube is given, and no wound is drained. Urine observation is normal, the color is normal, concentration is normal, no presence of stone, no blood in urine, and no catheter is inserted. Urine output is normal. The way of nutrition, now the patient is permitted soft food diet, and there are no restrictions. NG and all is not needed, as the patient will be discharged by the evening. No complications, and re-examination is done throughout the day, as said prior in the video, and the dressing is changed once. There is full mobility, not full, but there is mobility, and yet not mobility of activities on daily basis. The intake and output, the intake by mouth is 2000 and IV is 0, as it changed prior day, and the output is of the urine is 1000, no vomit and no drainage. Local status, that is abdominal pain, is only 2 points. Prior it was 4. No distension, no gas, no flatulation. Peristalsis is there, and there we can see the stool at 5:45, and the patient is ready to be discharged. Thank you.